there's got to be more patients out there like me than just me. I would like them to examine this method, and I would like to see it more widespread.
Why travel so far?
The traveling isn't even knowing about it. You have to know about it to even find you.
Yeah.
And over the course of the last 34 years, I've done lots of research on TMJ and seen lots of doctors. And until you know about a treatment,
Yeah.
you're not informed.
Yeah.
And unless you're informed, you don't know what to do.
Yeah.
So this just needs to be looked at by the hierarchy, I guess, of dentistry,
Sure.
to where it's not something that somebody has to go searching for, a layperson. It's something that a doctor who treats TMJ should know about.
Right. And you understand and accept the fact that your joints are damaged.
Yes.
But you see, instead of us crossing our fingers with a splint, seeing if it changes, we went in there and we imaged you. An
Yeah.
hour later, we have MRI data that we know how to interpret and CT data that tells us if you're stable and adapted or
Yeah.
not. And you get that. I mean,
Yes.
The hinges are damaged. We explained that you were young when it happened, and and it makes sense.
Yeah.
And you can even recall the accident, right?
Oh, yeah.
Second grade.
Second grade.
And he tripped you in the hallway? Some kid?
Tripped me in a marble floor. I went down and busted my mouth.
You traveled again. It's been
Yes.
3 months.
Yes.
And all in all, are you happy with the end result? I mean,
Yes.
after the DTR.
Yes. I would like to say that I was totally healed, but
No.
I
We
am
know that.
absolutely on a path to where I can function. Prior to February, it was
It was bad.
very bad. I could not get away from the pain in my face, despite going to a massage therapist every other week,
Mhm.
seeing a chiropractor. I was almost to the point where I couldn't function.
How much better do you think you are?
I would say about 40%.
Mm-hmm.
It's by far better than what I was.
Sure.
So if I stay right here, I'm happy with that.
Right. And we rechecked your data today, and it actually looked really good.
Yeah.
The bondings that we had to bond all 4 of your canines, and to be clear, your case was a very, very sketchy case. This was beyond the norm. We normally don't go quite this far treating one like this, but you were willing to take the chance and understood that there were multiple layers, and we did our thing, and so it sounds like you're at least somewhat better,
Oh,
and it's lasting now.
Yes, yes, and if this is what I have, that's great.
You'll take
Because what I was before was not manageable.
So you're not taking any meds anymore?
No.
So
I'm not waking up several times a night, because I used to. I used to
Okay.
wake myself up grinding my teeth, and I don't do that anymore.
what advice, if any, do you have for people in general?
Well, I was finding it difficult to try to find something else, and would only let myself go online, which is how I found you.
Yeah.
So my advice would be, don't give up looking for help. And if you've been suffering from any of the TMJ related pain, I would definitely recommend coming and seeing you.
Just to at least get looked at, evaluated.
At least know where you are.
With the imaging, with all the data that's
Because
objective.
I had no idea what my jaw joints looked like or any of that, and it's good to just know.
Prior to seeing us, you were asking people for information and imaging, for example,
Yes.
right?
Yes.
And they wouldn't give it to you.
Yeah.
The normal dentist, the
No.
specialist, the TMJ specialist, quote unquote.
I've seen 4 TMJ dentists,
Yeah,
and I was never imaged.
right. And what did they do? Just built you splints.
Splints?
That's it.
Yes.
And everyone said their splint would be better than the last splint.
Well, that, and I've had trigger point injections into the muscles, and I've had Botox injections, and all that does is treat the symptoms.
Right, basically.
Gives you a little bit of relief.
So now here you are out at 3 months. Botox would have wore off by now.
Oh, yeah.
Easily.
And the second time that I had the Botox wasn't as effective as the first time.
Yeah, that's classic too.
So
Yeah.
what point is there to even, do that if each time it takes a little more,
Mhm.
lasts a little less.